Hello, this is Dr. David Green, CEO of the U.S. Rehab Network. Today's topic is what makes for the best drug rehab center. First, let's look at the scope of the problem. Substance use problems affect 24 million people in the U.S., and over 40,000 deaths occur from drug overdoses annually in America. 3/4 of those are from opioid abuse. Alcohol now contributes to over 500,000 deaths per year. Are the best rehab centers outpatient or inpatient? Well, the best offer both. Effectiveness with outpatient programs can reach as high as 60% after an inpatient stint. That was a study looking at cocaine at the University of Pennsylvania. 80% of outpatient alcohol programs can succeed after an inpatient stint. Inpatient treatment for opioid dependence is 14 times more likely to have patients stop using the substances after a medically supervised detox as opposed to simply outpatient alone. So it's a key and crucial component. 91% receiving inpatient services had a successful recovery from alcoholism as well. So when you look at empirically supported treatments outside of medical detox, the two forms of treatment that have shown effectiveness include both a pharmaceutical aspect as well as a psychotherapy involvement. With looking at the pharmaceutical aspect for alcohol, there's 3 medications that have been approved: acamprosate, disulfiram, and naltrexone can all be effective. And then for opioids, there's medications that act on the same brain areas and the receptors as morphine and heroin. They can suppress the symptoms of withdrawal, but they do need very careful supervision, and those are methadone and buprenorphine. The psychotherapy component is just as critical as the pharmaceutical. Looking at cognitive behavioral therapy, it can recognize the maladaptive thought patterns and distressing emotions and the behaviors that lead to drug use and help to, change those and counteract those, which is one of the reasons why 90-day programs are so effective as opposed to 30. Motivational interviewing increases the motivation to change, and then group therapy increases social support, develops the concrete skills for dealing with cravings, boosts coping skills, and can also simply just educate members about drug addiction. So looking at the medical detox component, this lasts 4 to 7 days depending on the substance being detoxed from, and this gets the alcohol and or drugs out of the system with board-certified providers safely managing that detox to prevent withdrawal symptoms. When you look at a 90-day stay, the longer stay is critical to success long-term. There was never any medical evidence backing up a 30-day program. This was just a cookie-cutter program that was put into place and blanketed through marketing to the public, but there was no statistically significant evidence showing that it worked. The 90-day programs offer over double the success rates of the 30-day. There's actually studies showing that if a person leaves a program before 30 days, they might as well have just stayed a day or two, and 30-day programs just are not nearly as successful. Aftercare support is absolutely critical. Relapse rates can approach 60% for drug addiction if these aren't in place. The top centers provide support groups, continued psychotherapy, and other forms of aftercare support. The best drug and alcohol rehab centers offer both inpatient and outpatient treatments for the highest success rates imaginable. There's over 100 rehab centers nationwide in the network, with immediate insurance verifications being available, and the network takes care of all the arrangements, including travel and intake. Call us today at 888-598-0909 and visit us online at usrehabnetwork.com. Your recovery starts here.